Good morning to all of you who make this broadcast possible. Good morning to Abdiel, who supports us from the studio, and everybody who even on Saturday is up and tuned in to be briefed on the pandemic in Cuba and in the world. Today we have at this hour 282 patients admitted to our hospitals, 14 in vigilance, 191 are suspects, 77 are confirmed. In our primary healthcare system, our professionals and specialists follow up 233 people. Yesterday, we managed to increase the number of samples with the purpose of continuing to look for asymptomatic people carrying the virus, contacts or not of people already diagnosed with the disease. And the island's molecular biology laboratories processed 3,339 samples. In the Pedro Cubrí Tropical Medicine Institute, they processed 1,422. In Villa Clara's Provincial Center, 467. In Havana's, 460. In the Brother Almeida's Hospital, 431. In the Genetic Engineering and Biotechnology Center, 282. In Santiago de Cuba's Provincial Center, 267, and in the laboratory of the Civil Defense Research Center, 10 samples were processed. As a result of the study of these samples, 7 people tested positive for SARS-CoV-2 in Cuba. Thus, the island accumulates 202,014 samples studied and 2,420 have tested positive. This represents 1.2% of all the samples studied. Yesterday, samples were studied from all provinces of the country. Havana had 2,522, Matanzas 66, Villa Clara 106, Cienfuegos 91, Ciego de Ávila 76, Santiago de Cuba 126, and so on, from all provinces. Today, regrettably, we have to report the death of a patient and convey our condolences to the relatives and friends of a Cuban citizen who had tested positive to COVID-19. It's a 68-year-old male patient from Havana who was a confirmed case contact. This patient had been admitted. He began showing symptoms on June 30th. He was hospitalized in the Joaquín Albarrán Hospital. He underwent there the rapid test for COVID-19, which turned out negative. A febrile condition predominated in the patient. He was diagnosed with an unspecific febrile syndrome. It was supposed to be dengue fever, and after undergoing dengue fever tests, it was ruled out, it was negative, and the patient was discharged from the hospital with follow-up treatment. Regrettably, while being home, he felt short of breath. His relatives called an ambulance and he was transferred to the 10 de Octubre Municipality Hospital. He was assisted in the emergency room, but unfortunately, he passed away despite resuscitation maneuvers that were performed on him. The COVID-19 protocol established in our country establishes that even though the rapid test had been negative during the necropsy of the patient, a sample was taken to verify that the patient did not have COVID, and the test was positive. And this is the protocol in our country. So this patient had as underlying conditions a chronic obstructive lung disease and high blood pressure, and after the autopsy he tested positive, and even though he had been admitted and he had an abrupt death. I reiterate our condolences to his relatives, colleagues, and friends. The 7 cases confirmed yesterday are all Cuban. 2 are confirmed case contacts, and 2,100 cases diagnosed in our country. We're talking about 88.3% of all cases in our country have tested positive as confirmed case contacts. In one of the cases diagnosed yesterday, the source of infection could not be determined, and now we have 111 patients during all the pandemic. 4 of new cases have a source of infection abroad. These are Cubans who had recently arrived in the country, and in accordance to the protocol established, they were kept in isolation for quarantine, and they underwent, as it is prescribed, the PCR tests, and 4 of them tested positive. With these new cases, 167 of all cases diagnosed in Cuba, 7% have contracted the disease abroad. This is a risk group, and this is the reason why these actions need to be performed on people who return to the island, to put them in quarantine as soon as they return to the country, so that they can be studied to discard they carry the virus before they return to their daily activities. Of the 7 confirmed cases, 3 are female and 4 are male cases, and the sex balance remains. 49.5% are female cases and 50.5% are male cases. 57.1%, that is 4 of the 7 cases diagnosed yesterday, were asymptomatic, something very typical of this disease. And there are already 1,321 diagnosed people in our country, 54.5%, who have been asymptomatic at the moment of testing positive to the disease. If the studies had not been conducted, they would not have been detected. On the confirmed cases in the last 15 days, this percentage has been, during the pandemic, I said, of 54.5%. Now it has increased to 75.3% of the people diagnosed who were asymptomatic at the moment of the test. Yesterday, there were no cases under 20 years of age. 6 were from the 40 to 60 years of age group, and 1 over 60 years. 4 cases are from Havana, Centro Habana, Habana del Este, and Cerro. There are 4 in Havana. 4 of the cases are imported cases. Of the 7 cases that were diagnosed in Cuba, when they arrived, they had been incubating the disease. This is not considered a transmission of a disease within the country, which is why the cases are not included on the incidence rate from their places of origin. That's why 2 of the cases are from Havana, 1 is from Santiago de Cuba, and another from Villa Clara. These are the imported cases. They are not a result of these are the imported cases. With these new cases, Havana remains in the first place in terms of positive rate, with the highest number of confirmed cases in the last 15 days, although it is the same it had yesterday, 3.64 per 100,000 inhabitants. Mayabeque remains in second place with the same incidence rate, 1.82, which is lower than yesterday. And I always reiterate that 13 provinces and the Isle of Youth Special Municipality continue without confirming cases in the last 15, 30, or 60 days. They remain without reporting cases, despite the fact that samples are collected and processed on a daily basis.
Llevan más de 15 días en la fase 1 de la primera etapa y se mantienen sin diagnosticar casos, a pesar de que, como yo siempre
with 2,420 patients diagnosed with the disease until 12 o'clock last night, 77 remained active, admitted. That's 3.1% of all diagnosed people. 75, that is 97.4%, are with a stable clinical condition. With the death that we informed today, and we reiterate our condolences, Cuba accumulates 87 fatalities people who have died in our country due to the disease. We always mention the 2 people who were evacuated, and with these 87 deaths, Cuba remains on the 21st place among the countries of the region of the Americas, according to the region's fatality rate, and the 104th place in the world. We have the 2 evacuees, and yesterday 5 patients were discharged, for a cumulative of 2,254 patients who have been diagnosed in Cuba with COVID-19, that is 93.2%, who have recovered and have being clinically and epidemiologically discharged. 4 of the discharges are from Havana and 1 is from Mayabeque, and the 2 patients we had in a serious condition that we informed about yesterday, they remain in the same condition. They are admitted to the Salvador Allende Hospital. For 15 consecutive days, we do not have critical patients to report. A clear demonstration of the effort of our country, of our specialists of the public health system, and from other sectors who conduct research, and they provide their input to the treatment and preventive measures that have led to these results. In the world, the same 185 countries remained to diagnose cases of COVID-19. This countries reported a total of 228,299 cases for 12,245,417 confirmed cases. Notice how the number is increased by 1 million every week. We have to remember that when the pandemic began, it took the world some almost 3 months to reach the first million of cases. And what's even worse, yesterday 5,445 people died to this disease, for a cumulative of 554,721 deaths in the world, for lethality of 4.53%. The region of the Americas remains the epicenter of the disease in the world for more than 2 weeks, and it reports 6,406,420 confirmed cases, and it already accounts for 52.31% of all the cases reported in the world. And yesterday, it confirmed 139,717 new cases. Yesterday, in our region, 3,670 people died, for a cumulative of 4.37% lethality and a cumulative of 280,190 deaths. In the world, the region of the Americas, the list of countries with the most confirmed cases remain. The United States is in the first place. Of the 6 million cases reported in the region, this country, the United States, has 3,118,008 cases that have been diagnosed in the United States. Yesterday, it reported 63,004 new cases, and 982 people died in this country, for a cumulative of 133,291 deaths. Brazil follows second with 1,775,779 confirmed cases and 42,619 deaths yesterday, and 69,184 deaths, with 1,222 reported yesterday. The other countries, these 2 countries are followed by India, Russia, Peru, Chile, United Kingdom, and Mexico. And this is the information we had on the behavior of the pandemic in Cuba and around the world.